Okay, so on behalf of the Community Foundation for Palm Beach and Martin Counties, I want to welcome everybody to our 2023 Donor Luncheon. I'm Jeff Stoops, and I am privileged to serve our community as the new chair of the Community Foundation's Board of Directors. And even though I started only in July, I am pleased to be able to say that my family and I have been partnering with the Community Foundation for a number of years, just like so many of you. And we have a packed house, and the reason I'm kind of moving things forward here is we have a limited amount of time, and we have some great speakers that I know you'll want to hear from. So we would ask that you eat while we talk, if that's okay. Please feel free. So our donors, each and every one of you in the room today, have helped propel the Community Foundation's ability to give for good. We all share a commitment to addressing the opportunity gaps so that people in every corner of the counties that we serve can thrive. And there's always more to do, as we know, here at the Community Foundation, and particularly around a challenge that we highlighted at our Founders Luncheon, and that is so pervasive, which is access to high-quality mental health care. So as you know, mental health affects people of all ages from all walks of life. In Palm Beach and Martin counties, over 22,000 of our neighbors called 211 helpline in crisis last year. And the representatives from 211, please raise your hand. Some of you know this, but many of you may not. The 211, actually its predecessor, which was under a different name, was the very first nonprofit that the Community Foundation ever funded. So unfortunately, 211 helpline is very busy, and over 850 of those 22,000 calls were related to suicide. So earlier this year, at the Founders Luncheon, we asked the community to support nonprofit organizations that address mental health for our area's children, adults, and senior citizens. And for those of you who were there, you know that the community really responded. In particular, the family of Margaret Donnelly, who is our community's undisputed champion for mental health and joins us today. And I didn't get a chance to see Margaret earlier. Margaret, are you here? Yes, there's Margaret. So Margaret's family really stepped up. Her daughter, Sean, issued a matching challenge to support some key organizations working on this issue, some or all of which I know are represented here today. Mental Health America of Palm Beach County, the Autism Project of Palm Beach County, and NAMI of Palm Beach County. And Sean also opened a general community mental health fund in honor of Margaret. And I'm really pleased to be able to tell you today that the Donnelly Challenge has raised over $200,000. Yep. And more than a third of those dollars have already been put to work through our community foundations, nonprofit partners who receive competitive grants in the mental health areas. So again, thank you very much for that and for the good work that it's doing. So we're proud of our progress, and there's a lot that we can talk about, yet the gap between what we have done and what is still needed is growing, unfortunately. So this is why we are compelled to keep this issue at the forefront, particularly with individuals like you who understand the importance of addressing mental health issues in our community. And to lead a further, more specific discussion about those issues, please help me welcome Danita Dehaney, our President and CEO of the Community Foundation.
Thank you very much. Well, hello, everybody. Thank you, Chair Stoops. And let me just offer a very warm welcome to all of our very generous donors who have made time for us today. I would be remiss if I did not share how grateful we are that you've chosen the Community Foundation as a philanthropic partner for you and your family. So thank you for that. The team, the Community Foundation team and I, we are so motivated to continue this conversation about mental health. And we're motivated because we know that this problem is solvable. Our brains and behaviors can be rewired through technologies and therapies that have been designed, tested, implemented, and tracked by experts in the labs and on the ground. And we are very fortunate today to welcome 3 of those experts who will share their perspectives on the state of mental health in our area and why these experts, are optimistic about the future of this issue. So Lauren Zuckman, Lauren, where are you? There you go. Lauren is the executive director, I've got to take this off. Lauren Zuckman is the executive director of BeWellPBC. It is a county-wide initiative focused on advancing behavioral health and wellness for our residents. Lauren specializes in working with youth, adults, and families with substance abuse, domestic violence, crisis management, and mental health challenges. Thank you, Lauren, for being with us today. The next person I'd like to introduce is Ellen Pajkalkiewicz, and she is the director of the Stoops Center for Communities, Families, and Children at Florida State University's College of Social Work. Her team has been integral in helping over 1,400 children in Palm Beach County learn cognitive-based therapy skills through the Stoops Center's Rebound and Recovery Program. And she's been doing this with her team in partnership with the Boys and Girls Club. And Jeannie Miranda is here. Jeannie, please stand. Jeannie is the president and CEO of the Palm Beach County Boys and Girls Club, and we are the trifecta. We've got Ellen and her team, Jeannie and her team, the Community Foundation staff, and we made a difference in over 1,400 children, helping them to navigate life's disruptions. So thank you for your leadership. And then lastly, I'd like to introduce Barbara Andraka Christou, or Basha, as she prefers. Basha collaborates with Ellen's Stoops Center, and she is an associate professor at the University of Central Florida's School of Global Health Management and Informatics, and she has another appointment at UCF, and that's in the College of Medicine. We are so happy to have Basha here because she is an expert in the implications of unaddressed mental health issues, particularly in Florida's foster care and judicial systems. Please help me welcome Lauren, Ellen, and Basha. Okay, so we're just going to get this conversation started. And Ellen, I'm going to begin with you. So help us understand why evidence-based knowledge is the starting point for understanding mental health and its treatments. And secondly, how has the knowledge shaped the Stoops Center's Rebound and Recovery Program and the outcomes that you're seeing in Palm Beach County?
Well, I think the first thing is evidence-based. There is like a very formal process, but the federal government uses, for example, and they like to fund then the development and implementation of those evidence-based practices, and then they do a clinical trial. So you all are familiar, I'm sure, with physical health clinical trials, but these are mental health intervention clinical trials. And once you have made it through those clinical trials and have been evaluated, your intervention can be sort of entered into that lexicon of evidence-based treatment. And why do we want to focus on that? We want our nonprofits across the country to be benefiting from the research and the power of the universities to say, this is a technology that can get these outcomes. And you're not just making it up on the fly. With fidelity, this program will get you these results. And so we are really interested at my center in not only disseminating evidence-based practices to communities so that they're more successful, but we use 4 C's. First, we like to connect. So we could connect to the Community Foundation, the Boys and Girls Club here locally, Brevard County Schools, Leon County Schools. So we love to connect first to really determine, to do a lay of the land as to what the needs are and to analyze those needs in a scientific and research way. And then, so we connect and then we collect. We do all kinds of assessments, get a lay of the land, and then we even, as part of that collection, evaluate how we're implementing. So let's say in Boys and Girls Club in Palm Beach, part of that project is really evaluating, what's working, what is not working, not only evaluating the data of the kids or what's taking place with the kids, but just how it was implemented. So that would be, that third C, and then getting to catalysts. I mean, the purpose is really for sustainability. So catalysm and really being augmented the work that we can do so it's sustainable and replicable and scalable to a larger level. And we, I have more to say, but I'll stop right there.
Excellent.
I could go on and on.
Thank you. So let's unpack that just a little bit. So when we say that mental health issues are solvable, what we're saying is that research and knowledge at one of Florida's preeminent universities has gone into designing the intervention through the data collection, the clinical trials that give me and others like me and you the confidence to say, this works. This problem is fixable because we have seen the results in the assessments that the College of Education is doing at FSU on behalf of this program. So to Ellen's point, it's not enough to say, oh, we can do this, we can do that. You have to be able to speak to the evidence, and that it is research-based, research-informed, and clinical trials demonstrate that you can actually rewire the brain so that someone thinks differently about the situation in which they find themselves. So thank you for making that accessible to us. Basha.
Should we advance the slide?
Who's advancing the slides? There we go. Well, thank you.
So just one last comment about just the rebound and recovery very specifically. And it's that power of philanthropy meets the power and the resources of universities. And so without philanthropy through the Stoops Family Foundation and the Community Foundation, rebound and recovery would not exist. And we were able to do it for young children and now teens, and the teen part is only because of the Community Foundation. So something that didn't exist now exists. We needed the seed money just like any other startup, and we were able to develop that with your support. So I just wanted to make sure that people are seeing the connection at the university. There aren't funds to necessarily always just do something that you feel is important.
Exactly. So you've got the research, you've got philanthropy, and now we have impact. So let's pivot for a minute, and let's look at, Basha, this is directed towards you. Now, your expertise is in implementation science, and I have to say that when we were working with Basha in preparation for this, I told her I had never heard of that term, implementation science. And it's actually, what I learned, the next step in the process after programs like Ellen's are introduced. So Basha, tell us a little bit more about what implementation science is, why treatments or therapies that are evidence-based and research-based may not get to the people who need them the most. And please give us an example so that we can all learn and follow along with regard to implementation science and its implications.
Sure. So I have up here on the slide an example I'll walk through in a moment of implementation science at work in your county here in Palm Beach. But let me just preface this by saying that we have a lot of studies of whether it's medications or therapies or technologies that work very well in clinical settings. These are controlled environments, laboratories, if you will. And then we take them into the real world. and then suddenly we find they're not being used, or maybe the efficacy is not as great as we would have expected based on the results we saw in the lab. So what implementation science does is it's a set of tools to understand what are those barriers in the real world and how can we address them. So for example, maybe people simply aren't using the intervention, whatever that may be, in the real world because they don't know about it, or it's too costly, or it's too confusing. And so implementation scientists like myself will go in and try to understand how can we increase the uptake of these new therapies or new technologies. So in Palm Beach, one example is there's a wonderful family dependency drug court, or what we also call a family treatment court, that I evaluate in one of my projects. And what this court is designed to do is to connect parents with children whom they have lost custody of due to severe mental health issues or drug use issues. And we give the parents the therapy, the medications, the treatments to stabilize themselves and then hopefully reunite them with the children. Really important for the safety of the community and the well-being of these children and families. So one tool that in the laboratory works well is something called child-parent psychotherapy. And this is a type of therapy that's very useful for children and parents who have encountered traumatic situations. And both the parent and the child attend the therapy together. Unfortunately, in the Palm Beach court and in other areas in the US, this has been underutilized or maybe not utilized as effectively as it could be. So our team went in to understand what is going on, how could we increase the uptake of this important tool. And what we found after talking to staff in the court, to actual participants in the court program, the parents, is that there are a lot of barriers in the community. Maybe there isn't transportation to get to the therapy. Maybe there aren't funds to actually pay for the therapy itself. Maybe the parents don't quite understand what this therapy is and it sounds kind of scary to them. And so we need to destigmatize it to begin with. Maybe they have other children who need childcare while they're going to therapy. So we collected all this information and we tried to understand what is something we could do to improve the use of this child-parent psychotherapy tool. And one of the recent developments in mental health and substance use treatments is engaging peer support specialists, and they can help address a lot of these issues. So peer support specialists are people with lived experience with mental health problems or substance use problems, and they serve as a liaison between that parent or that person who needs the treatment and the actual treatment provider, and also in our case the court. And they, if you will, hold the hand of that person who needs help. They will actually physically take them to the treatment center. They will help them fill out the forms. They will help secure, whether it's child care or housing needs, whatever can really help connect that parent, that individual needing treatment, to the treatment itself. And what we've seen in the Palm Beach Family Court is that suddenly the uptake has now increased because those peer support specialists are there to hold the hands of these otherwise very vulnerable individuals who really need help navigating a very complex medical system, very complex healthcare system. So that's just one example in your county specifically of implementation science at work.
Thank you, Basha. So, quick review. We're understanding the importance of research and philanthropy married together to create an impact. And now, from an implementation scientist, we're learning that while all that may be in play, things happen. And sometimes these great treatments and therapies don't actually get to the intended audience. And so the development of the peer specialists helps to navigate and break down some of the barriers to accessing the treatment. So let's now turn our attention to Lauren and BeWell. Lauren, like many of our nonprofit partners, your work and BeWellPBC crosses both worlds, knowledge and implementation, and embedded in that are the barriers. So, what does our community need next? And please describe for our audience how or what our youth and families are asking for and what we can do to help.
Thank you, Danita. I really appreciate that you are wanting to know what youth and families are asking for. BeWellPBC, the Palm Beach County-wide Behavioral Health and Wellness Initiative that I'm the executive director for. That's just what we do. Our core value and really our organizing framework is around not just asking residents of all ages, youth, adults, families, what they want and what they need, but also bringing them to the table to be a part of design of programs and services, to be a part of implementation, to be a part of that decision-making process along with funders and providers and all of the traditional people that make decisions for behavioral health and wellness in our community. So that's really important to this, to make sure we know what can truly work in our community, hearing it straight from them. We do a lot of large-scale projects that incorporates all of these great partners and different perspectives in our community. Just recently, we hosted something called the Rally for Youth Mental Health, and that was bringing together youth leaders, funders, elected officials, the school district, anyone that can touch or do work with youth, clergy, lived and learned experts is how we talk about that. Having them all in the room to talk about what are we going to do with this youth mental health crisis that we are in, not just in Palm Beach County, but across the nation. And what came from that was a lot of information that we walked into that rally with around what are youth right now saying are their mental health struggles. Through surveying and focus groups, not just done by us, but done by partners. There's even a national youth risk behavior survey where youth, very large sample size of Palm Beach County youth, were asked what their top 5 struggles are. And those equated to relationships with their parents and caregivers. It was cyberbullying and bullying. We know technology plays a big piece into that. It was around friendships, relationships with friends or the lack thereof. It was carrying that idea and feeling of hopelessness. We talked about not just suicide rates, but also just that feeling of being isolated and alone. And that's not just from the pandemic, that's well beyond, right? That was happening before. There's a lot of trauma, unfortunately, throughout our community. And of course, it's thinking about safety. Our youth don't feel so safe anymore. We hear about a lot of the things happening in our schools by no fault of the school systems, but also our youth don't feel safe in the community either. And so those 5 top concerns is what drove this rally that we hosted, actually in this room back in August. And what we brought forward with those 5 struggles were, okay, so what are our priorities? Mental health is vast. There are a lot of things you can work on within the mental health field. And so these were the 8 priorities that our community here, with all those different people that I mentioned, that they were really focused on. And you can see some of them are pretty broad. Some of them are a little bit more specific. But then what we did is we took these 8 priorities and we dug into them. We said, so what are some solutions? What already exists in the community that we can build upon? And what are some new creative ideas for how to address these 8 priorities that our community now is agreeing on and having consensus around? This is where we want to focus. And so I just want to give you an idea of 3 of those solutions that really was lifted up out of this rally. The first one was around wellness, prevention, mental health awareness. And so that idea of the fact that we all have mental health, right? And we need to take care of it. Not wait to react to challenges, but really take care of it in a very proactive way. And so how can we support youth to feel safe in their community, support their parents who are probably going through some struggles too? How do we help them from the very beginning and increase that mental health awareness so they know how to take care of their mental health? We're very lucky here in Palm Beach County. We have a national, really international training called Mental Health First Aid, if all of you are aware of it. It's like the CPR for mental health training. And it teaches tips and tools and what is mental health and some self-care and what to look for if someone is maybe struggling. And so that is a really great tool, very accessible. We also have some what we call mini trainings that have been offered out in Palm Beach County. And one in particular, it's called Mental Health for Youth. It was created by youth with professionals, and it is trained by youth who are trained as trainers, and they go out to schools and churches and after-school programs to teach their peers about mental health. What's so great about that is you're not just teaching them how to talk about mental health, you're building their capacity possibly to be in the mental health field. So it's a lot of benefits to supporting youth to do that. So that's one solution idea. A second solution idea was around clinical care, right? We know we need, it's the mental health space, we've been talking about this, we need to support clinical care. We are a community full of excellent behavioral health providers, and there's always room for expansion of those services. Something that the youth and families were really talking about is how do we get those services to come to us? Basha was just talking about transportation barriers. There's a lot of barriers to be able to get services. We're a very large county. Transportation is a top barrier. And so the idea of co-locating clinical care where youth already are, where families already are. It could be in those churches and synagogues. It could be in after-school programs. The school district is a great example. They have co-located something like 35 agencies at over 100 schools where the therapists have offices and almost you would think they're staff as a part of the school. And again, so many benefits because they get to know the area that they're working in, they get to know the families, they might even get to know them before they provide care. And so thinking about co-locating agencies, we have agencies in the room that are co-located in grassroots initiatives throughout the county, recreation centers, parks. It's a really great way to make sure that people have access and feel comfortable because they're in their own space. The third solution that I would offer is that idea of clinical care can't meet all of the needs. So there has to be something to complement that. And so there was a lot of conversation at this rally about non-traditional supports, something that very much can go hand in hand with clinical care, but then be there when eventually the clinical care ends. So we mentioned peer supports. Peer supports are one of my favorites. We have some excellent agencies in our community. NAMI, I know Catherine Murphy's in the room. MHA, I know Andy McCausland's in the room. This idea of peers who have lived experience, who can say, I've been there, I've done that, and can really sit with individuals, with youth, with families, and say, okay, I have an idea of where you're coming from, how can I support you? And they do all kinds of things at their agencies, one-to-one support, support groups. They provide support not just to the individuals, but to the families, which is so, so important. And so part of the conversation at the rally was, how do we do this for youth? There are youth peers out there, but if we wanted to expand on that idea, how can we have youth peers so that the lived experience of our youth can then benefit other youth? And again, it goes back to, and you're building capacity. So there's layered benefits to employing peers and building capacity of our community to serve themselves.
Thank you, Lauren. You know, when I first came to understand Be Well and this rally that you did, this was an example of one of our nonprofit partners going to the community and getting their voice and taking the information that was shared and embedding that into the solution. And that does a couple of things. If you go back to Basha's point about implementation science, they may not understand it. But if they're part of what Be Well is doing, they're learning about it as it comes around, and when they have the need, they'll have a better understanding of why this intervention is important. And when you think about the research and the evidence that shows that it's proven this is going to work, that information can be integrated into the programs that Lauren and other nonprofit partners are facilitating on behalf of our community. So you can see that solving this problem is not just a one-stop shop. It's a holistic initiative that is grounded in evidence, that takes into account barriers that affect an individual or a family from getting the help they need, and it's also including them in the solution, getting their input so that they are empowered to take or participate in the intervention that's best for them or their families. So I think we have time for a question or two. So I'm going to ask the audience if anyone wants to ask. You've got 3 experts here, FSU, UCF, and BeWell in our community. Yes, sir.
So my question would be for Basha, is where do you source your peer support system personnel?
Did everybody hear that in the back? The question is, where does Basha and her team at UCF source peer support for the program that they're doing here in Palm Beach County?
So our research team at UCF, we evaluate what other programs are doing. So we're not the ones actually hiring them, but I can tell you that the Palm Beach court that we work with here, there are really great, as was mentioned, agencies of peer support specialists that court goes to, and they contract with those agencies. The specific agency that this court contracted with is called Rebel Recovery, and those peer support specialists are unique in that they also have a lot of lived experience with substance use issues, which is a key problem in the family dependency drug court, as the name drug court recommends or suggests. But there are, in pretty much every major community, I would say there's at least one peer support agency that people could go to or organizations could go to either hire or contract with a peer support specialist.
Any other questions or comments? Yes, all the way in the back. Oh, it's Ernie Ellison, one of our board members.
Definitely need a mic.
Yeah.
Basha, correct?
Yes.
I recently started to work with the Criminal Justice Commission, and what I'm finding is that the system leading up to the point is not really working for individuals, and we always say whenever there's a crime, it's mental health.
Right.
So is there a way that there could be a closer connection between the research work that you do and the criminal justice system?
So there's a really important model that is being used now more and more in the criminal justice research dyad, and that's the intercept model. And the idea is that at various points before someone, let's say, gets incarcerated, we could intervene as a community member. It could be, before they commit the crime, obviously would be the ideal, but even then, maybe after arrest, before they actually get, arraigned and into the system, so to speak, maybe we can divert them into treatment. And then, if that doesn't work, then maybe they go into a drug court. And then again, that's another type of diversion. And then even once they're in the carceral system, actually having treatments and rehabilitation opportunities in the criminal justice system. So the idea is that at every intercept in the criminal justice path, we want to embed mental health and substance use treatment opportunities, because I completely agree with your point. There's almost always some relationship between crimes and either mental health or substance use issues. And historically, our justice system has really focused more on punishment and not so much on the rehabilitation angle. And frankly, it's not effective that way, and it's very costly to the community overall, but also to the family members and the children of the individuals who get incarcerated. So really excellent point, and that's just one potential model to consider.
And I will just add the Criminal Justice Commission just actually facilitated the intercept mapping, and many of us as providers and different systems participated in it to walk through all the different intercepts and to talk about the barriers, the successes, what we need to do, and really meant to move towards, okay, action, what will we do now? And so I know the Criminal Justice Commission will have a whole report about what came out of that, and there are work groups that are forming and lots of action steps that will be happening in the next few months.
Ellen?
And really, to tie it back to some of the work that we do, there's been research and studies over and over that show if you have quality preschool, so that's the program that we're working with Leon County is pre-3, pre-4, that they did a longitudinal study, so a long year study of children that were in Ypsilanti, Michigan preschool. They tracked them for, I think, 40 years. So academic performance increased, college attendance increased, crime, meaning interaction with juvenile justice or the adult system, decreased, the income earnings was increased, the marriage rate was increased. I mean, just go on and on and on, all from having quality preschool. And that is something that I think is also important to say, is quality preschool requires that we recognize those teachers and provide them trainings and education, which is one of the things that we're doing in Rebound and Recovery, is we have a professional certification.
Thank you. Please join me in thanking Ellen and Basha and Lauren for joining us today. As I said, the team and I are very motivated about this issue. You know, the Donnelly family kickstarted our initiative to help direct funds to solve this issue. And we remain motivated because it's solvable. And we learned today just how fixable it is. And because of you, the three of you, we have hope. We have hope that we can actually make an impact in our community by addressing this issue. And so we are going to continue to talk about mental health, and we're going to continue to discuss how it can be addressed and what we need. Ellen talked about the power of philanthropy and how that prompts and bolsters their work and our work in helping to address the needs of the children that reside in our communities. And so we are going to continue to ask for your help as well. It's imperative for the Community Foundation to continue to talk about this issue. And as we learn more about it and its scope, we're going to continue to share that with you so that you too can be informed and knowledgeable about mental health and how we can actually address this issue as a community. And the way in which we are going about this is through the Community Mental Health Fund that Chair Stoops mentioned earlier. This fund is, it supports our annual competitive community impact grants. You may have read in some information that we sent that last year we received over $19 million in requests, and we only had $4 million to allocate. This year we're resolving to close the gap, particularly for organizations who are focused on mental health. So at your table, you will find a card with a QR code to help you connect to the Community Foundation's Community Mental Health Fund online. And it is next to our thank you gift for coming today and our thank you gift for partnering with us philanthropically. It is a small plant that represents our growth as all of us give for good together with you. So let me close by reiterating our heartfelt gratitude to each of you, our donors. Thank you for partnering with the Community Foundation to make a difference on the causes closest to our hearts. Thank you for trusting us to care for your funds. And thank you for being a part of making our community safer, healthier, and happier for generations to come. And we look forward to welcoming you back next year. Thank you, everybody.